Today, I have the opportunity to talk with Brent Bartholomew. Brent is the president of Ortho Development Corporation in Draper, Utah, suburb of Salt Lake. I've had the opportunity to know Brent over the past few years, and full disclosure, I am a distributor of Ortho Development as one of the companies I represent. So welcome, Brent.
Thank you, Stu. Good to be with you.
So Brent, as you know, and everybody knows, joint replacement is changing drastically. Cases are being driven from the hospital to ASCs or even in the hospital, being done as outpatient procedures. Reimbursement continues to go down. So there's a lot of challenging things happening within joint replacement and orthopedics today. So from your perspective, how do you see a smaller company like Ortho Development and Ortho Development specifically fitting into that landscape?
Yeah, that's a great question. Well, first of all, thank you again for having me. And this is a great opportunity for me to introduce the company to people that might not know who we are. So I'll take just a moment and briefly do that. Ortho Development was founded back in 1994. So doing the quick math, it's about 27 years now in business. And we are, as you mentioned, located in the Salt Lake City area in Utah. We're a very unique company. We are a design, manufacturing, and distribution company of orthopedic implants and instruments. Our primary focus is hip and knee replacement. And we also do some trauma and some spine design and development and manufacturing for the Japanese market. So speaking of Japan, our company is the majority-owned subsidiary of a distribution company in Japan called Japan Medical Dynamic Marketing. And they are a publicly traded company in Japan. Ortho Development is privately held and privately owned by them. And yeah, so it's been a fun ride. I've been at the company since February of 1999. So coming up here on almost 23 years early next year. So been quite a ride for me. My original background was in the finance world. I worked for the Salt Lake City office of Deloitte, and this company was one of our clients. So I've absolutely loved orthopedics, and it's been a great ride for me. So our company, as we've gone about, I guess, making our way in this industry, our calling card has been the ability to be flexible and to bring some efficiency to the people that use our products. From the very beginning, we have had the philosophy with our products of something we call evolutionary innovation. And what that means for us is taking the best clinically proven technologies and making unique refinements to those. And so we've tried to watch what really works well in the marketplace and try and make again, some unique refinements to both implants and instrumentation that can lend to more efficiency in the operating room, and ultimately we hope better outcome for the patients. So to your question, as we watch things shift in the market, how is Ortho Development positioning ourselves, and what advantage does a small company bring? And I think first and foremost, it would be the flexibility and the ability for us to partner very directly with a surgeon, with an ASC, and specifically, we've kind of taken a look at basically, a program that can take our implants and our instruments, and essentially what we would do is help you as an ASC or as a surgeon gain some operational efficiencies. We've partnered with some other third-party companies to offer some pre- and inter-op solutions with enabling technology. We think that one of the things we're working on right now is some patient engagement and satisfaction, an initiative and some programs related to that. And then ultimately surgeon resources. Some of the surgeons that we've worked with already that are in ASCs, the opportunity for you as a surgeon to, if you're looking at what's it going to take for me to move my practice and move some of my business to an ASC, I think that we can put you in touch with some of our surgeons that know firsthand what you're taking on here. So, yeah, I guess the way we look at our company is, we don't have, there's not a lot of bureaucracy.
Right.
When you're dealing with our company, we tend to be the company that will listen, and we're willing to be flexible with you, whether that's in the hospital or in the ASC. And we're not afraid to make changes if there's an instrument that doesn't quite work well in your hands. We're willing to customize, and ultimately, with that patient outcome in mind, we want you to be satisfied, and we don't want the switch between being in a hospital to being in an ASC to be anything that would compromise, again, that efficiency or the outcome.
Right. And I can see that. I've seen it firsthand over the past several years with the quality there. But something that you've mentioned in the past that I think is worth noting is since you have a majority shareholder, a Japanese company, that gives you a flexibility that a lot of these other companies that are beholden to their shareholders, that gives you a flexibility that they don't have.
Yeah.
Can you talk how that is an advantage to perhaps the end user as well?
Yeah, absolutely. One of the things that we like to emphasize, especially as we're as a surgeon, a distributor, starts looking at carrying our products, is that we have been around for 27 years, and that we're not. Our model is that the ownership by the Japanese company provides a lot of stability and longevity for our company. So I always joke that we've been in business 27 years and we're going to be in business 27 more. And I think that that's important. It's also allowed us as a company to, from the very early days, to punch above our weight, if you will, as it relates to the products that we've developed. And, compared to some of our other smaller competitors, I think we have really a premium lineup of implants and instruments that stack up very well against any company. We never we'll ask anyone to take a step backward as far as technology or in materials, or ultimately we feel like our product is on par. We're biased, we think it's a little bit better, but the truth is that we've met that bar. And then what that affiliation with the Japanese company also does for us is that as we see an opportunity to go into an area, we have some flexibility with we're not beholden to a public market here in the U.S. and shareholders that way. And it allows us to really go and aggressively partner with an ASC, whether that be, in pricing or in providing them, whatever the efficiencies that they need in order to make that transition as smooth as possible.
Right. And I mean, you mentioned something about I think you mentioned frustration, and frustration is something that I see on a daily basis, almost from even competitive reps in the industry or surgeon customers who are wanting to take it there. And you touched on that. And I think that's a huge thing, is that being someone or a company that has fewer levels of bureaucracy really allows you to be more agile and nimble to actually address real issues that physicians are having.
Yeah, absolutely.
Right. So another thing is, just as an example, you guys recently came out with a new product launch on a revision knee system. Just tell the audience a little bit about what that means to the company and what that entails with the new balanced knee revision 2 system.
Yeah, no, absolutely. Thank you for the opportunity. So the balanced knee system is our flagship product. It was designed in the late 90s. We launched it in the year 2000, and has been a phenomenally successful product for us. Really has been our flagship. It's driven the company's sales for all these years. And we in the very early days, we recognized that if we were going to be competitive in the market, we were going to need a revision knee system. And so by 2003, we had launched the first part of the balanced knee revision system. And that system did very well, but I'd say about 5 or 6 years ago, we recognized that there was an opportunity for us to do something special with revisions. And we were watching and looking at the marketplace, and we saw that there basically were two camps out there. One that espoused using sleeves for very difficult revision situations, and the other that espoused using cones. And I guess we were audacious enough to say, hey, why not offer both?
Right.
And some people said, oh, you're crazy. That's too much gear to try and offer both type of systems. But as we worked with our design team, and our design team was split probably evenly. Some were really in favor of cones, other in favor of sleeves. But yeah, I guess the flexibility that we have as a company allowed us to take that big audacious step and say, we're going to offer both. And so we are the first company to offer both cones and sleeves. And ironically enough, it's been interesting to watch the guys, especially maybe going back to the design team. Some of the guys that said we would never use sleeves, these are cone advocates, have ended up using sleeves from time to time, and vice versa. And so the interoperative flexibility that is offered with this system is phenomenal. And you have the ability to go into a case and as the surgeons, as the reps that listen to this podcast know, you never know what you're going to get with a revision. And so the system, we've been now in what we say full market release, full market launch here for coming up on a year. It'll be a year in November, and system's been well received. We have quite a few users, and we see that as an area that is a little bit of a kind of a specialty niche for us. We also have a related product for treating infections in a two-stage revision. It's called Chasm, and that's also a product that's done very well and opened up some doors for us.
Right. And last question, I kind of want to get back to what you termed as evolutionary innovation. And I know I've heard you talk and speak to this in the past, but as a smaller company, you know that there's perhaps a perception on, not having the product offering that other companies have. So again, touch on that. And even I know that Ortho Development was the first company to offer 1 millimeter increments in polys. So what has been your philosophy on really that evolutionary innovation and making significant improvements?
Yeah, going back to the very beginning, again, the real first significant product that we launched back in the year 2000, this balanced knee system, the questions were asked. And back at that time, there was one of the big issues or one of the big concerns that surgeons had was backside wear with the poly and the locking mechanisms, locking the base plates into, or the inserts into the base plates. And so one of the things that our engineers came up with was a very unique patented locking mechanism, a rail type system, and that virtually eliminated any backside wear. It was tested in Seth Greenwald's lab and showed like a 95% reduction in micromotion compared to our closest competitor. So that was a big step. That was, one little example of asking a question: what's a concern right now, with these implants? And I guess it's been gratifying to watch a lot of other companies kind of copy that technology as best they can, getting around our patents. And as you mentioned, we also took, again, kind of an audacious step in the sense that up until that point, the polyethylene thicknesses were 2 or 3 millimeter jumps.
Correct.
And so the surgeons that we were working with on the system were adamant and really, advocates of balancing. And they thought that, well, if we can balance with 2 or 3 millimeters, what can we do with 1 millimeter increments with polyethylene? And initially I'm a finance guy, and so I looked at it, and that's a lot more inventory to be carrying, but also the recognition that the polyethylene is the least expensive piece to manufacture in that construct. And so we felt like if basically we thought, hey, this could be advantage for us in the marketplace. And again, most all the other companies have now copied and are using 1 millimeter increments in their polyethylene as well. But just a couple of small examples of how we've tried to take evolutionary innovation, and each of our products through not only the the knee system, but all of the hip stems and the hip cup that we offer also have little similar stories.
Right. And I'll add something that you left out, is that most companies have 1 millimeter increments for the first 4 or 5 sizes, where Ortho Development has almost doubled that with 8 sizes. The first 8 sizes, you have 1 millimeter increments. So
yeah, we really feel like you can really balance a knee using our implants.
right. Well, hey, Brent, I appreciate the time that you've taken out to talk with me. For anybody out there who is interested in connecting with you, what is the best way for them to do that?
Yeah, thank you. It's a great question. You can go to odev.com, and right there on the website, there's a section about contact us. Anyone's also feel free to reach out directly to me. Again, this is putting my money where my mouth is. As a company that doesn't believe in a lot of bureaucracy and you got a direct line to the top, send me an email, brent@odev.com. And we'd be happy to connect with you and have some conversations.
All right. Thank you very much, Brent. And we will talk soon.
Okay. Thanks, Stu.